Welcome back to Detroit Wants to Know. We've taken a break from the barbershop. It's been pretty heady stuff we've been covering down there. We're in lovely Bingham Farms, Michigan. No, we're not going to Dave Bing's house, which is right up the road. We're not going there. I'm here to take you to Dr. Louis Radden's spine clinic. Dr. Radden is an African-American doctor that is at the top of his field. And you all need to hear what he's saying. If your back hurts, you need to listen to this. Dr. Radden, thank you for allowing me in lovely Bingham Farms. I'm sure my hall pass will be off soon. First of all, why in the world should people come to you versus these millions of other spine doctors that are out there?
First of all, the spine specialty, subspecialty in and of itself, there's not a tremendous amount of spine surgeons in town. Probably throughout the greater Michigan area, there may be 40 or 50 spine surgeons that cover the entire state of Michigan.
Well, I may be wrong, but I see all these signs that say back pain.
Well, what you have to understand is that there are some back pain clinics. However, some of these clinics are specialized in physical therapy or chiropractic care. They're not necessarily surgeons.
They're not necessarily surgeons.
Correct.
Okay, so in the morning, okay, I get up, I work on my computer, then I read for about 2 hours, and then I go hit the gym. But I find myself walking hunched over, okay, sitting at my desk. I'm sure there are a lot of people in America that are sedentary that do that. Are these the type of people that should come see you? What happens?
Well, what we have here is we have a comprehensive spine center. One of the facets of the spine center is that we have rehab, and for those particular type of patients, they should come in for an evaluation and develop a protocol or a home exercise program to have preventative maintenance from preventing their backs from getting injured.
Okay. Now there's some people around that have had chronic back pain for years. They've had surgery. It doesn't work. What do you do?
Well, for those patients, they need to come in for an initial evaluation. We'll obtain CT myelograms as well as MRIs. We'll evaluate the nerves as well as the structural areas where the patient has had a previous operation. If the operation is intact, we'll talk to them about a procedure called a spinal cord stimulator. This is a procedure in which we can actually insert leads into the epidural space. These leads lie posterior to the spinal cord. They send out neural impulses to the spinal cord, and we're able to control the pain and even block the pain if it's in the back and legs or the neck and arms. There's a 3 to 5 day trial period. If they are successful during the 3 day trial period and we're able to control their pain, then at that point we select them to undergo a stage 2 dorsal column stimulator. The stage 2 just simply means that as opposed to being connected to an external battery, they are connected to an internal battery. The internal battery is placed into the right or left buttock area. We actually create a very small pocket. This is a very minimally invasive procedure. This is not a back operation. We don't even alter any of the spinal structures. But this is a procedure that is very nice to control back pain as well as leg pain and neck and arm pain.
I can't believe we've come that far. I mean, when we were younger, we used to watch the Bionic Man and Bionic Woman. I can think it's the Bionic Man whose back they replaced. You're talking about going and putting in wires in somebody with a battery to stimulate their back to get rid of the back pain.
That's correct.
That's wild. Children. Do children come to your type of clinic?
We will see children for an initial evaluation. What we're trying to determine is the cause of their low back pain or their mid-back pain. In children, the first thing we look for is scoliosis. If the child does have the diagnosis of scoliosis, we'll obtain the appropriate films, we'll evaluate the curve. At that point in time, we'll determine the appropriate treatment for that child.
Really? That's impressive. Now, it seems painful. Is this type of surgery painful, or when people come to get back treatments, when they get their shots, is that painful? What is it?
Well, again, for the surgery center part of our practice, we are able to perform 90% of spinal surgeries on an outpatient basis. If you come in for a procedure, we have full anesthesia. We actually put the patients asleep. It's not painful. And they're able to actually get treatment and relief on the same day.
Beyond the children's injuries that you talked about, children coming in here to see you, All right, and beyond the, the plans, if people just have back pain, what kind of injuries are you seeing? Are you seeing much from auto accidents?
I see a lot from auto accidents. I see a lot from workers' comp injuries, police officers with heavy gun belts.
Wait. Tell me about that.
Basically, police officers have a propensity to develop back pain because they're carrying around a 17-pound gun belt all day. They're sitting in their cruisers, they're riding, they're getting in and out of cars, and they develop a high incidence of lumbar strain, sprain, as well as disc herniations.
Really?
Yes.
Okay.
So,
continue. What do you do about that?
So, for instance, a lot of these patients, workers' comp injuries, they fall off ladders, auto accidents. It doesn't take much to actually irritate the low back. The muscles can be irritated, they can be strained, they can be sprained. Discs can herniate, they can easily cause inflammation of the nerves. That's why patients develop radicular symptoms going down the legs. The way we treat these things is with a comprehensive program of physical therapy as well as epidural steroid injections. The epidural steroid injections is a combination of steroid as well as a local anesthetic that we place the steroid around the nerve. It helps to decrease the inflammation around the nerve. The local anesthetic can actually shrink the disc down a little bit. And that way it helps to decrease the inflammation around the nerve. And the patient gets good relief with the back pain as well as the leg pain and neck and arm pain.
Okay. I hate to say this, but you talk about a police officer carrying around a 17-pound belt all day.
Correct.
Okay. This is a little bit bigger than a 17-pound belt. Do you see it much from overweight patients coming in with back problems?
Yes. And a lot of it has to do with the oversize of the pannus or the abdominal area, and that creates a strain on the low back.
Pannus. Abdomen. Okay. All right. Just making sure. Okay. You went to Lutheran High West.
In St. Martin de Porres.
And
yes.
St. Martin de Porres.
Yes.
So you're a product of Detroit.
Correct.
All right. And then you went on to Duke.
From there, I went to Wayne State to do my undergrad. From Wayne State, I went to Michigan State to do my medical school training. From Michigan State, I went to did my residency in orthopedic surgery at Robert Wood Johnson, UMD&J in New Jersey, and then to Duke to do my fellowship in reconstructive spine surgery.
Man, that's amazing. How do people, where do people call to set up an appointment with you? Because I know there are a lot of people with back pain.
They just call the office. This telephone number is 248-792-9496.
792-9496.
And they can learn more about the Spine Center. Just go to www.spinemi.com.
Okay. Dr. Radden, you're excellent. It's good to know that the Radden family has a multitude of people. We have the lawyer, we have the king of all that is soul food, and we have the spine specialist. Okay, Doc, thanks again.
Hey, thank you for having me on the show.
I'll try to not come out to Bingham Farms too much, but I might have to come check it out. I got that big pannus. Okay. Ladies and gentlemen, when we get back, we're going back to the barbershop. It's still popping. It's on and popping down at Marcus Iverson's spot. We'll be right back.